Hi, I'm Matt Adamkin. I'm from Louisville, Kentucky, and I'm a physical medicine and rehabilitation doctor. I work in Fraser Rehab Institute. For me, it's beyond just helping people, it's trying to empower people. As a physician in physical medicine and rehabilitation, what we're all about in rehabilitation is really trying to empower people and return people to their prior level of function and maximize their functional capabilities. So that was my draw to the field, that was my draw to medicine, and that's why I decided to become a doctor. As a physical medicine and rehabilitation physician or physiatrist, I run an inpatient service in Fraser Rehab. We call it the medically complex rehab service. I take care of people with life-altering events, so strokes, amputations, cardiac failure, whatever it might be, that have been through prolonged hospitalizations and have really experienced a functional decline. In addition to all their medical complexity, they come to my service and I take care of them while they do their inpatient rehab. And then in my clinic, I run an amputee clinic where I work with local prosthetics groups and try to support people with limb loss and get prosthetic legs. And then I also work in a multidisciplinary clinic for adults with intellectual disabilities. The approach for everybody, regardless of why they happen to be sitting in front of me, the foundation of that is just getting to know them, understanding not just the circumstance that they're in, but what their prior level of function was, what they want to accomplish, and moving their attention away from what they cannot do as a result of their injury or their illness towards what they can do and what they dream of doing, and what we can do as a team, patient and physician and all of our therapy support, to try to accomplish returning them to the level of function that they want to be. Even though the field is physical medicine, the psychological component, the mental approach is just as important as the physical. And particularly on the inpatient rehabilitation side, that's all part of our multidisciplinary and comprehensive approach. We involve psychologists in people's care, neuropsychologists, in addition to the therapists and the physicians and the nurses that are working with them. To have U of L Health come over and take over our operations has really unified our ability to provide care from the acute hospital into the post-acute hospital over at Fraser, and know that we are all working as one team in one system, receiving patients from U of L Health facilities and sending them off to see other U of L Health physicians. I think it really streamlines our approach, it makes it easier, and I think ultimately it's better for the patients. I am born and raised in Louisville. I went to University of Louisville for medical school, so this is home for me. My wife and I and our 6-month-old daughter with our dog and our cat live here. My brother-in-law has Down syndrome. He's a Special Olympian, so we spend a lot of our time volunteering with Special Olympics and just going to Special Olympics events as a fan and supporting him and the local teams.